Welcome back to the Society for Pediatric Pain Medicine Visual Pulse series. This is the infraorbital nerve block. The infraorbital nerve is a terminal branch of the maxillary nerve, which is the second division of the trigeminal nerve. The areas blocked are the lower eyelid, the upper lip, cheek, lateral nose, and up to 4 teeth and gums from the midline. To find the infraorbital notch, palpate below the pupils on the upper third of the cheek. There are several ways to block the nerve. The out-of-plane approach. Avoid vascular structures if possible with hydrodissection and careful needle control. The in-plane approach. Avoid injection into the foramen. The in-plane approach from below. Block with a smaller gauge needle and 1 to 3 milliliters of local anesthetic. The complications are hematoma, seizures, and persistent paresthesia. The indications are infraorbital blocks are mostly used for cleft lip repair. Also, lacerations of the cheek, upper lip, and lower eyelids. It is used less commonly for nasal surgeries and pain conditions such as trigeminal neuralgia. The benefits for kids with cleft lip repair are quicker awakening and improved analgesia, and quicker feeding and better oral intake. The ultrasound technique is safer and more effective than blind techniques. Thank you again for watching us.